There are a few blood vessels you need to be able to identify and locate. The aorta is the major artery of the body. As it leaves the heart, it goes upward for a short distance, and this is called the ascending aorta. Then it curves across the top of the heart to make the aortic arch. We use cats as our dissection animal because they are very similar to humans, but there is a couple of differences every once in a while in the cat, and one of them occurs here in the aortic arch. In humans, there are three blood vessels that come off of the aortic arch: the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. There are only two blood vessels that come off the aortic arch in the cat: the brachiocephalic artery and the left subclavian artery. Here on this heart model is the ascending aorta and the aortic arch, and this would be the brachiocephalic artery, the left carotid artery, and the left subclavian artery. Here in the cat, the ascending aorta and the arch, only two blood vessels, the brachiocephalic and the left subclavian. As we look at the human anatomy here, you can see that the brachiocephalic artery comes off of the aortic arch, and it's going to branch into the right subclavian artery and the right carotid artery. Then the left carotid artery will come straight off the arch, and the left subclavian artery will come straight off the arch. In the cat, there are only two arteries that come off the aortic arch. The brachiocephalic artery is going to make three branches. It's going to feed into the right carotid, the left carotid, and the right subclavian. The left subclavian artery will go down the left arm and become the axillary artery as it moves into the armpit, and then the brachial artery as it moves into the upper arm. So let's look at this cat picture. Here is the ascending aorta and the aortic arch. The brachiocephalic artery is the first artery that comes off. The second artery is this left subclavian. And as the left subclavian moves into the armpit, it becomes the left axillary artery. And as it moves on into the arm, it becomes the left brachial artery. Looking at the branches of the brachiocephalic artery, we have the right subclavian artery, and as it goes down, it will become the right axillary artery and the right brachial artery. Then we have the right carotid artery, which is going to go to the right side of the brain, and the left carotid artery, which will go to the left side of the brain. The descending aorta comes off of the aortic arch and goes down the back. The thoracic aorta is the part of the aorta that's above the diaphragm. And coming off of the thoracic aorta, we have the intercostal arteries. Below the diaphragm, it is known as the abdominal aorta. There are several arteries that come off of the abdominal aorta: the celiac artery, the superior mesenteric artery, the right and left renal arteries, the inferior mesenteric artery, and then the abdominal aorta will branch to become the right and left iliac arteries. When the right and left iliac arteries leave the body cavity and enter the thigh, they become the femoral arteries. So looking at the descending thoracic aorta, this is the lung that's been reflected back, and we're looking down the left side of the vertebra. That aorta is pretty much against the backbone, but you can see these fine blood vessels coming off of it. These are the intercostal arteries. They feed the muscle between the ribs. Here in this picture of the human, we see the descending abdominal aorta. We have the celiac artery stub here that's going to feed the stomach, the superior mesenteric artery that will feed the upper part of the large intestine and small intestine, and the inferior mesenteric artery that will feed the lower part of the large intestine. The aorta branches to the right and the left iliac artery, and when it leaves the body, it becomes the femoral artery. Also coming off of the aorta are the right and left renal arteries that go to the kidneys. Looking at the cat, we have the descending abdominal aorta coming down this way. Then we have the digestive arteries, the celiac artery, which is right under the diaphragm. About 1/4 of an inch below the celiac artery, you will see the superior mesenteric artery. And then if you come all the way down to the bottom, you see the inferior mesenteric artery. These are the arteries that feed the digestive system organs. These are single arteries. They're not paired, and they just come off by themselves, and then they branch as they get into their individual organs. The paired arteries are the right and left renal artery. You have a right and left kidney, and you have an artery that goes to each kidney. This is the left kidney, so here's the left renal artery. There is a right renal artery on the right side. The descending aorta comes down and will branch into the right and left iliac arteries. We can see the left one here. And as we leave the body cavity, go through that muscle wall and get into the thigh, that becomes the left femoral artery. The superior and inferior vena cava are going to return blood to the right atrium. The right and left jugular veins drain the head, and the right and left subclavian veins drain the arm. These two veins merge to make the right and left brachiocephalic veins, which merge to form the superior vena cava. Also in the thoracic region is the azygous vein, and the azygous vein empties into the superior vena cava as well. The azygous vein is another unpaired blood vessel. In the human, the jugular veins drain the head, the subclavian veins drain the arm, and as they merge, we make the brachiocephalic veins, and the brachiocephalic veins make up the superior vena cava. Here in the cat, coming back from the arm, we're going to have the left brachial vein, which will turn into the left axillary vein, which will become the left subclavian vein. Coming back from the head, we have the left jugular vein. Where these veins merge, we're going to have the left brachiocephalic vein. On this side, we have the right jugular vein and the right subclavian vein, and they're merging to make the right brachiocephalic vein. The two brachiocephalic veins merge to make the superior vena cava. You'll remember that blood has a hard time returning to the heart from the lower part of the body, and we have some mechanisms to help it return. One of the mechanisms we have is the azygous vein. Now this is the lung that's been pulled back, and we're looking at the right side of the body. Here's the superior vena cava coming down, and here is the azygous vein. This is an unpaired vein that assists the inferior vena cava in returning blood to the heart. Because the azygous vein empties into the superior vena cava, there's a little bit of a sucking pressure up here because remember the right atrium has zero pressure in it, so this vein has a little extra assist with the zero pressure sort of pulling blood up in the azygous vein. The femoral veins become the iliac veins in the pelvic region. The right and left iliac veins are going to merge to form the inferior vena cava. The right and left renal veins will empty into the inferior vena cava, and the inferior vena cava will deliver blood back to the right atrium. In the human, the femoral veins are not shown, but here are your iliac veins merging to form the inferior vena cava. Here are the right and left renal veins joining the inferior vena cava. This is going up through the diaphragm back to the heart. In the cat, the femoral vein is out here in the thigh. Once we cross through the body cavity, we're going to call it the iliac vein. Since we're on the left side, this is the left. The iliac veins, you can see the right iliac vein right there, is going to join with the left iliac vein to make the inferior vena cava. And the only other blood vessel that joins here is the left renal vein. There's also a right renal vein. And just to show you that a little more clearly, here's the inferior vena cava and here's the left renal vein. Again, there's one on the right side. The venous blood from the digestive organs, you'll remember, is drained by the hepatic portal system. The blood is processed in the liver before it's returned to the inferior vena cava via the hepatic vein.